Thank you for joining me today. My name is Bridget Garner, and I'm going to be talking about creating clinically oriented and case-based OER materials for the instruction of veterinary clinical pathology. I'd like to begin by acknowledging and thanking my proposal and project collaborators, Dr. Schlemmer, Tarigo, and Meichner. I'd also like to thank the Educational Resources Center here at the College of Vet Med for creating some beautiful instructional materials. Thanks to the Open for Student Success Symposium for allowing me to share our conclusions from this project, as well as the Affordable Learning Georgia for funding this project as part of a continuous improvement grant. The four collaborators each contribute to a core pathology clinical rotation for third and fourth year veterinary students here at the College of Veterinary Medicine. This is a required rotation that spans an entire clinical year, but students are with us for only 3 weeks, each in groups of 8 to 10. And we teach approximately 150 students over that year-long period. Topics include hematology, cytology, clinical biochemistry, urinalysis, immunophenotyping, molecular diagnostics, and more. And while there are a lot of wonderful veterinary medical textbooks out there, usually they focus on only one, maybe two of these topics. And so if students want to have resources, obviously they would need to buy a lot of different texts. This, in conjunction with a growing concern about veterinary educational debt, led us to realize that open educational resources are particularly important for our veterinary medical students. We also know that clinical students have reported to us in the past they are most excited to learn from clinical case scenarios rather than just reading a textbook. So the four of us got together and generated a list of approximately 40 cases to be designed. These were going to be categorized into 3 tiers of increasing complexity and represent a variety of species and diseases relevant to an entry-level practitioner. We would then each approximately take 10 of these cases and compile them from various resources and cases we've encountered in the past, making sure to remove any identifying patient data. These case scenarios had laboratory data as part of the information included for each case. And if there were microscopic lesions, we would take images to allow students to practice interpreting cytologies and blood smears. If there was background information that we felt like students could brush up on while trying to review these cases, and it was available on one reputable OER veterinary website in particular, then we would include links to that as well. And that website is eClinPath. During this process, we recognized a few difficult concepts that students continue to struggle with and or felt like there might be procedures that students had not yet performed themselves. And we worked with the educational resources team to develop either animations or instructional videos to help fill in these gaps. The next few slides represent some screenshots from examples of these cases, and you'll see that the level 1 cases, which are the most straightforward or basic, do span a variety of veterinary species. Riker, in particular, is an example of a level 1 case, and he is an indoor-outdoor cat that has a history of being a little bit tired, vomiting, and not wanting to eat. Students then work through a series of laboratory data from a complete blood count and a chemistry panel. And because in Riker's case, vomiting was involved and GI abnormalities often will lead to very complex changes in some of these data, the students were then able to work through a series of animations that help them understand why those particular changes are happening in a case of vomiting. You'll also see that they could click through some different information provided on that eClinPath website to again help them fill in the gaps if there's something they felt they needed to investigate further in order to understand it at the case level. In the second week of the rotation, we then move into the slightly more complex cases, or the level 2 cases. Spark is an example of a level 2 case, and Spark is a dog who presents for a mass on the face that the information given is we know a little bit about it. However, the concept being discussed here is what's going on in the submandibular lymph node, a lymph node up under the jaw. In this particular case, again, there is laboratory data in the form of a CBC and a chemistry, but now we're building on that and also working to hone our microscopy skills. Students initially see images and or the glass slide from what's seen on the left and are asked to recognize that instead of that being normal lymph node that is reflected, instead this reveals that the salivary gland in a similar region under the jaw was aspirated. We then give them an opportunity to review a second aspiration attempt, which reveals the typical components of a lymph node with no concerning findings. At this time, their case pack includes instructional videos on one, how to aspirate a lymph node if that's not something that they have performed themselves just yet, as well as how to prepare the glass slides so that they can maximize their cytology results from that aspiration attempt. In recent years, there has been quite an expansion in digital cytology offerings, some of which offer interpretations of images obtained from smartphone cameras. And so students are also given the opportunity to watch an instructional video on how to take good images with their smartphone camera, as we feel like they're going to have opportunities to do so out in practice. These and all the other materials were completed and then implemented in the fall of 2022, and we immediately got positive feedback. The instructors reported that they enjoyed the breadth of cases as well as the ease and the ability to choose based on students' interests and abilities. And the Jeopardy style board in particular worked very well for this, particularly if in a particular week you weren't able to finish all of the cases for that level. Students indicated that the variety helps them maintain their interest, and they appreciated the increasing complexity across the 3 weeks because they did note their own improvement in their skill set. They also felt like the clinical cases were representative of general practice, which they greatly appreciated. From the collaborator perspective, 10 cases each was achievable. Any more than that would probably have been too much at the time. But in the process of doing this, we did generate a list for additional cases we want to build in the future. Even though we agreed to a standard format during the development of these cases, we did assign one person to kind of go through and review everything and make sure that it was as standardized as possible. And that was very useful because inevitably there were some variances that needed to be addressed. In this process, we developed 2 versions, one for the students and one for the instructors. Students had access to their version prior to the group discussion so that they could review the case basics without necessarily having the answers or the case conclusions that the instructors then revealed during the in-person discussions. Overall, this was a really great experience, and we hope to continue building on it to expand the offerings that we have for open educational resources in veterinary medicine and veterinary clinical pathology in general. If you have any questions, you are welcome to email me and I can attempt to address those. My email address is on the screen. Thank you.